Since I've been seeing Dr. Ware at Detroit Injury and Pain Centers, he has made me aware of my benefits under no fault. I'm able to get my bills paid, my transportation, and medical care. He's been excellent, his staff has been excellent, and I've received the care and the information that I needed.
Welcome back to the show. Dr. Ware is now going to give us some great information about knowing your rights when you're involved in an auto accident. Doctor, tell us what those rights involve.
Well, Joy, this is Michigan. It's a no-fault state, okay? And most people don't understand what no-fault really means. No-fault insurance doesn't simply mean going out to get you some insurance so you can drive around.
Okay. No-fault
insurance really means whether you hit somebody or somebody hits you, you're entitled to health care. Now, there are two parts to the no-fault state law. One, you can have either full coverage or what we know as no-fault coverage, okay? No-fault coverage is a basic term. Full coverage covers your car and you or anyone who is involved in the accident or sustained injuries in the car. Okay. It also may cover uninsured motorists. So you ever heard of uninsured motorist claim?
Yes.
Okay, then it does cover uninsured motorists if you have that on your policy. Okay. No-fault insurance pretty much covers the injured person. It's called a protectional injury protection coverage, commonly known as the PIP coverage. What that does is it takes care of you and your health care. Any event that you sustain injuries in an auto accident, you have your health care completely taken care of.
Wow, okay, that's good to know.
Most people don't understand their benefits.
Right.
Okay, it's outlined in your policy, step by step. On your insurance card, it says if you're involved in an auto accident, call your insurance first.
Yes.
Okay, I don't think you should call your insurance agent first.
Okay.
I think you ought to call the 911, call the police, make a report if you can. If you're injured, please go to the hospital, or you can come into Detroit Injury and Pain Centers for a checkup.
Now, you don't need a referral. We heard earlier, right, that you actually can come there because you are a primary care provider.
Right. You do not need a referral. That's the misconception as well. People think that chiropractors are secondary, which we're primary health care providers. You do not need a referral to come see us. We actually are knowledgeable in this area of auto accidents. We can take the x-rays, we can recognize broken bones, we recognize torn ligaments. If we're not able to recognize any of the diagnosis or anything that's going on with you, we can refer you out to a specialist, whether it be a spinal specialist, maybe you need surgery.
All right, doctor, let's talk about the do's and don'ts of an auto accident. What should you do and what should you not do?
That's an interesting question. Which one you want to start with first?
Let's talk about the do's.
The do's? Okay. First thing you should do is seek medical attention. Second thing you should do, well, it's not so much as in order.
Okay. No, that's right. There's no order to it.
I do recommend you see a medical doctor or a chiropractic physician within the first 24 hours. At least get a checkup. The longer you wait to seek medical attention, the less the insurance company think your injuries are significant.
Wow, so that's a key factor to why you definitely need to go right away so that you can take full advantage of all those benefits. So, doctor, we've covered what you should do. Let's talk about one of the things that you certainly should not do if you sustain an injury.
Well, I would like to go over every bullet point, but I do have a pamphlet.
Okay.
Okay, and I'm at
available at your office?
Yeah, I do have a pamphlet available at my office. Also, I actually created a book over the do's and don'ts, or the consumer's guide to sustaining an auto accident.
And what's important to our consumers, doctors, is that it is free of charge.
Yes, it is.
Only available at Detroit Injury and Pain Centers.
Correct.
All right, let's talk about some of the things that are in there. You outlined this entire process that we're talking about today.
Right. I outlined everything that's in Michigan no-fault law. Okay. I give the consumer the ins and outs and the do's and don'ts of everything they should do if they're involved in an auto accident. Whether they're going to the hospital, whether they call the insurance company, whether they call the police, whether they call the ambulance, whoever, you know, they need to know what to do and what not to do.
That's vital information, something that they certainly want to take advantage of, because there is a lack of education out there possibly about what you should do, so you've provided something for them right in your office.
You have no idea. There's information in this pamphlet that is extremely important to what you should do in the event that you're involved in an auto accident.
Only at Detroit Injury and Pain Centers, Dr. Ware and his staff will be more than happy to mail you out a pamphlet, correct, doctor?
That's right. If you call 313-579-3472, we'll be happy to mail a pamphlet out. The pamphlet is designed to fit into your glove compartment.
Great.
It has all the outlines that you need to outline an accident. It has actual questions that you can answer, and then you can get information from that person that was also involved in the accident. You can obtain the witnesses and things of that nature that are around in the accident that can help you in the event that you need to go into litigation.
Good. This pamphlet is almost as important as your license and your proof of insurance, right?
Well, you can't put it in your wallet, but you can put it in your glove compartment.
Certainly want to have it close by.
Yeah.
All right. Well, don't go away. Dr. Ware is going to share yet some more information with us. We'll be right back.
Since I've been seeing Dr. Ware at Detroit Injury and Pain Center, my symptoms are much better. I'm able to do things that I couldn't do before. I'm pain-free thanks to Dr. Ware in Detroit Injury and Pain Centers.
Welcome back. Dr. Ware is now going to demonstrate for us on this life-size model of some of the things that we talked about. Go ahead, doctor.
What we have, Joy, here is a life-size spine of an adult, okay? This is just a model, so it's not a real spine.
Okay.
Beware. Anyway, what I explained to you earlier, you see the carotid artery, how it travels through the 7 bones of the neck, and think about it. Now, if you're involved in an auto accident, this is what's going to get compressed. These bones actually move individually. Okay? Not only do they move individually, you can compress the blood vessel, which can cause a decrease in blood flow to the brain. That's your dizziness, and also lightheadedness. Also, you can compress these nerves that come out of the side of the spinal column. Okay? And what that does is cause pain in the muscles. The nerves travel to the muscle. The muscle is connected to the bone. So when you have injury, only muscle feels pain, such as the heart muscle. Okay, you have stomach muscles, that is a smooth muscle, that feels pain as well. And you have, you know, what we call our strong muscles, the one we use to lift weights. Those are all muscles. That is a striated muscle. Only muscles feel pain. You have organs such as your kidney, your lung, even your brain doesn't feel pain because it's not a muscle.
So when you have a headache, that's actually not brain pain.
No, it's not. It can be a number of it can be anything. Okay. It can be decreased blood flow. Okay, you get that throbbing, you know, cervicogenic headache, real pain. It can be the muscles that outline the actual skull. It can actually be a misaligned bone which compresses the nerve that is attached to the muscle that is attached to the skull. Okay.
Another injury that you might sustain is low back pain. That's a common one, right?
Yes.
Let's talk about as we move down the spine. Where is that on the model here?
Okay, this is the low back. This is what we call the lumbar area. Okay, you have a number of things that can happen to the lumbar area. Let's take a look. You have a herniated disc. That can possibly happen as a result of an auto accident. You can also have herniated disc in the cervical area, which is the neck. This is the mid-back area where the ribs are connected as well. There's a lot of people who sustain damage in an auto accident when their chest hits the steering wheel. Then you have what is called strain in this costal region, or maybe possibly broken ribs in that area as well. Another thing is I want to help you understand that here is an acetabulum. This is where the femur bone, which is the longest bone in your body, come out. What also happens as a result of an auto accident, a lot of my patients, I notice, knees get jammed under the dashboard. You notice that it's connected to the hip. So what is that going to do? It's going to shift your hip, shift your spine, cause problems in the spine and neurologically in the sciatic nerve as well, okay, which travels down your leg. So you have a lot of patients who come in not only with herniated disc, they have pain traveling across their buttocks, down their leg, which is a sciatic challenge as a result of the accident.
So now we learn what a sciatic nerve is. I've heard that term before.
Yeah, well, everybody heard of that. They got pain in their leg. I don't know what they call it, but it is a sciatic nerve.